As the province shifts how help is given to people who use illicit drugs, a warning from one Toronto clinic.
There's going to be severe implications.
Gab Lawrence at the Parkdale Queen West Community Health Centre is sounding the alarm as the doors of this supervised consumption site get set to close on November 22nd.
This is a life-saving service where people come and use their drugs safely and experience overdose response when that occurs. So without the service, we're going to see a significant increase in overdoses in public areas.
That's because the Ford government is pulling its funding over what it says is an increase in police calls for break-in-enters and assaults in the area. While Toronto police data shows an uptick in incidents in recent years, it's happening over a larger area going south toward Exhibition GO Station. Specific information linked to the consumption site wasn't available.
I think we're really struggling with housing issues, mental health issues, broader substance use issues. This isn't unique to Parkdale, it's across the whole city.
Another concern by some is finding needles in public areas and people gathering at a nearby parkette. During our visit, we saw security and center staff out walking the area.
People come into the service and have opportunity to dispose of their paraphernalia safely. And so without the service, there's one less resource to do community sweeps.
The centre here in Parkdale receives $1.1 million from the provincial government. But after the doors close, that funding is being redirected to what's called a heart hub.
Very happy that we've actually gone to a treatment model, not just illicit drug use.
Ontario Health Minister Sylvia Jones is defending the decision moving the money to the heart hub, which is one of 18 new provincial centres offering various health and social services.
We're literally seeing people served that are getting health care for the first time ever, that are getting supportive housing for the first time ever, that are getting access to treatment for their addictions and their mental health issues.
Heart hubs can be part of the continuum of care, but it's not exclusively the one solution that'll support substance use crisis across the city, across the province.
Back at the centre, Lawrence is broadly calling on more supports from the province.
Once we're gone, substance use will continue. So we really want to advocate for the expansion of services, the existence of services that are appropriate to people who require them.
And has this message for anyone who needs support after the doors close.
We're going to do everything that we can to support people's access to the last remaining safer consumption service in Kensington Market, but we have significant concerns for any overdoses that happen beyond us. We're going to certainly see an increase in EMS calls, public deaths, and other unfortunate health outcomes.
We'll have more on this story at citynews.ca. In Parkdale, Nick Westoll, City News.